Hello, welcome to our channel. Today I'm Gerard Massa, the health educator. Today we are talking about pelvic inflammatory disease. Today we shall explain everything about pelvic inflammatory disease. You have seen this a lot, and you have been, they've done ultrasound scans on you, and they've told you you have a PID, and you've asked yourself what PIDs or what a pelvic inflammatory disease means. So today we are talking about this, and simply pelvic inflammatory disease, this is when there's introduction of a variety of organisms into the reproductive tract, a combination of disease-causing organisms entering into a female reproductive system. Specifically, we call this a pelvic inflammatory disease. Pelvic is your waist area, the waist, and then inflammatory or inflammation, this is the body's response to injury, and then disease is basically sickness. So a combination of organisms entering into your waist area, specifically the reproductive system. When we talk about the reproductive system of a woman, we are simply talking about the two ovaries, we are talking about the fallopian tubes, we are talking about the uterus, the cervical canal, and all the associated or surrounding structures around the reproductive system. So how do these organisms enter into the reproductive system of a woman? Normally, the commonest point of entry, the commonest method by which these organisms enter into the female reproductive system is through sexual intercourse, but also it could also be through urinating in places that are not clean. So it is always very important to make sure that the person you are with should be your partner, and then it's always good to stick to one partner, not to be having many sexual partners. The more sexual partners you have, the more your chances of getting the pelvic inflammatory disease or having repeated PID infections. So whenever you get a patient, whenever you get someone telling you that they have got a variety of drugs, they can list for you all those antibiotics by name. You talk of one antibiotic, they tell you I've taken this. You talk of this, they tell you I have already taken that. It is normally a result of either resistance being brought about by repeated infections. How do we test for pelvic inflammatory disease? What are the tests that can be done if at all they have discovered or you have been told that you have a pelvic? How can they tell you? Which tests are done to confirm that you have a pelvic inflammatory disease? Stay with me, and that's where we're going to talk about today. Now, the first recommended test for women whenever they come in with lower abdominal pain, it is the pelvic ultrasound scan. It is very important to do an ultrasound scan because the ultrasound scan can give detailed images of the reproductive system. There's that part also called the rectourinary pouch or the pouch of Douglas, the POD area. Whenever there's fluid collecting in the pouch of Douglas, that is a confirmatory point for that could be a confirmatory of one of the tests, or it could be one of the tests leading us to say that this particular patient could be having a pelvic inflammatory disease. So presence of fluid in the pouch of Douglas it is among the first tests that confirm that a woman is having a pelvic inflammatory disease. Also, the other test that will be ordered is the urine analysis test. Presence of white blood cells and lots of pus cells and lots of yeast cells. A combination of parameters which are really not normal on the urine analysis test. This can also lead us to say that a woman could be having a pelvic inflammatory disease. I've just talked about the urine analysis test. If you missed our video, if you missed our lesson about urine analysis test, you should go look for this test. It is among the videos. I've linked them up there. It's among the videos we talked about. Go back and you'll get that lecture about the urine analysis test so that you can know everything about UTIs, everything about the various tests that can be done to confirm that yes, this could be a pelvic inflammatory disease. So what are the signs and symptoms of pelvic inflammatory disease? We were supposed to talk about this first before we go to the test. So stay with me, and we are talking about the signs and symptoms of a pelvic inflammatory disease. The first sign is there's lower abdominal pain, which tends to increase. This lower abdominal pain normally radiates to the back area. Radiating means it can even spread and it can go up to your back area. You will take all the painkillers thinking it is your back that is having issues, but normally the issue is not with your back. The issue is in the front part. The issue is in your reproductive system. The other sign and symptom of a pelvic inflammatory disease is that there is always pain during sexual intercourse with your partner, and this pain tends to also increase. It could also bring about blood coming out just right after you've been with your partner. And the other sign and symptom of a pelvic inflammatory disease is that there's that watery discharge that comes out, and this discharge normally has a bad smell. And next point is that the pelvic inflammatory disease can also cause pain that may actually spread all over the whole abdomen. So whenever you have pain, whenever you are having discharges coming out, blood is coming out, it could mean actually that there could be something else, like maybe endometritis or even cancer of the cervix, but those are differential diagnoses. Those are some of the other things we could look at. But since we are talking about a pelvic inflammatory disease, specifically, whenever you get any of these symptoms, this could mean that there's a problem going on. And when you suspect that there is a problem going on, what do? That's when we go to the investigations and the tests that can be done. We are talking about the investigations that can be done to confirm that now this is a pelvic inflammatory disease. Just before, in the beginning, we talked about the pelvic ultrasound scan, and we said that presence of fluid in the pouch of Douglas, and then also presence of fluid actually around the cervical canal, but most specifically the key is presence of fluid in the pouch of Douglas. Whenever you see that on your ultrasound scan report, then normally this could be among the leading features to show that you could actually be having a pelvic inflammatory disease. The next investigation that can be done to confirm that a woman could be having a pelvic inflammatory disease is the high vaginal swab, also abbreviated as the HVS. Here, a small swab is taken, and then it is actually there's some rubbing done in your private parts, and these cells can be taken to the lab, and they can be examined under a microscope. And the presence of many germs, microbes, on your report also drives us back to a PID. The next test that can be done is what we call the hysterosalpingogram. Also, it can be done most specifically if they suspect the hysterosalpingogram, if they suspect that the fluid has moved to your fallopian tubes. Then the HSG or the hysterosalpingogram examination can be taken, and most specifically this will show whether your tubes are blocked. But remember, when we talk about blockage of the tubes, we shall do a video about that. Blockage of the tubes could be bilateral or unilateral, meaning it could be affecting both sides, that is bilateral, or it could be unilateral, affecting only one tube. Still, we are talking about the pelvic inflammatory disease. The other test that can be done to confirm that yes, this could be a pelvic inflammatory disease is also what we call the urine culture and sensitivity test. Also, your urine is taken in the lab and then it is cultured, and a sensitivity report is given. This is a report to show which drugs, to show which organisms specifically you are having, and then there could be staph, Lococcus organisms, there could be a E. coli or a Escherichia coli, it could be any of the microorganisms. So the good news about the urine culture and sensitivity examination is that it also gives you the sensitivity report on what exactly, what drug specifically should be used. So it is one of the most fantastic tests that can be done, the urine culture and sensitivity test. So in summary, we've talked about the investigations or the tests that can be done. We talked about the urine culture and sensitivity test. We talked about the urine analysis test. We talked about the high vaginal swab. We talked about the hysterosalpingogram test or the HSG. We talked about the pelvic ultrasound scan if you are not pregnant, and if you are pregnant, we talked about the obstetric ultrasound scan. Actually, it is possible to be pregnant and at the same time have a PID. This is not good news, so it's always good to do the ultrasound scan, and then of course also these other tests we talked about. And also it's always good, it's a good requirement to do what we call a cervical screening test for cancer, because normally if the ultrasound scan has shown that there's fluid in the pouch of Douglas, and then also it has also shown that your cervical canal is swollen, then it is imperative, it is very important that you do also a cervical screening test for cancer. Thanks for staying with me for this while, and thanks for listening to our lesson for today. We are talking about PIDs. I'm called Gerard Massa. I'm a health educator. I do health education both online and offline at our clinic, Hope Nursing Clinic, and specifically we give information. Let me know if you have any additions or any subtractions you'd like to add in the comments down below. I'll be very glad to share, because it's always very good to share. By sharing, we get to know more things. So the next thing we are going to talk about, since we've talked about the signs and symptoms of the pelvic inflammatory disease, we've talked about the signs and symptoms of the PID, we've talked about the investigations for PID, what tests can be done, we've talked about all those. We are going now to talk about the management. How do we manage the pelvic inflammatory disease? Management, the first point I will address is treatment and management should be done by your doctor or your gynecologist. Make sure that you follow what your doctors tell you, because it is very important for follow-up, it is very important for close monitoring. So your doctor will analyze all the results that have come out. You will analyze all those results and then come up with a conclusion, or so also called the diagnosis. And then after diagnosis has been made, then drugs will be prescribed to you basing on the results, basing on what came out. But normally these drugs are antibiotics, and please avoid self-medication, because time can reach when these antibiotics may not respond to you, and that's when you may get cases of patients moving from place to place saying drugs do not work. So make sure that you follow what your doctor tells you. Also, the non-pharmacological management for PID, or the management of PID at home, just make sure that you get 2 cloves of garlic, mix them with lemon, and then put in hot water. Then of course take them daily, take 1 cup daily. This can help a lot. It can actually help to restore the pH balance in your system. It can also help to make the environment of bacteria it actually makes the environment for bacterial growth to be very difficult. And then also there are also other managements for PID, or you can do this at home. You can actually add some honey in the garlic and then you take. This can also help a lot, but specifically make sure that you do this in conjunction or in addition to what your doctor will be telling you. After you've got this treatment, just make sure that you do repeat tests for the PID. Remember the tests we talked about, the ultrasound scan, the urine analysis test, to confirm that this PID is over. The only way to do this is after treatment, after everything has been said and done, please, after a period of like 30 days or even 2 weeks, following what your doctor will tell you, go back and do what we call a retest. Have yourself scanned again, have yourself let your doctors test your urine once again to see. At first you had pus cells. Do you have pus cells? At first you had water, at first you had free fluid in the pouch of Douglas, according to the ultrasound scan. After treatment, do you still have the free fluid in the pouch of Douglas, or the fluid is over? That's the only confirmation of healing, of total healing. Remember, it's also very important to have your partner treated, because if you get the treatment alone as a woman and your partner has not got treatment, then your partner, your male partner, your husband, is going to give you again this infection, what we call reinfection. Reinfection is one of the leading causes of repeated PID issues. So just make sure that you involve your partner, and then also make sure that you look at the hygiene. Make sure that you wash your knickers, your undies very well. Make sure that you wash them very well, dry them, and then also iron them. The other thing is, make sure that when you do washing of your clothes and everything, just make sure that you put them in sunshine so that they dry, and then remember to iron them with a flat iron. And then the other thing is also, just make sure that you monitor where you do urinate, because normally you may urinate in a place much as it looks to be clean, but when it is being used by someone with a serious PID. So you see this, my friend, you've got all the treatment, you're now better, and then all of a sudden you go back, urinate in a place, and then you get a serious PID again. So just make sure that you look at the attention. I mean, you'll just monitor where you do squat to do urine, and then of course just make sure that you follow these instructions. They do work. And let me know if you have any questions. Gerard Master, the Health Educator, are my names, and please remember to subscribe, remember to like, remember to share this video with all our friends so that many of our friends get this information. Let me know if you have any questions. I will answer them personally. Thank you for staying with me all this far, and thank you. Have yourself a fantastic and blessed day. God bless you, and bye-bye.